Okay, so we on page 12 in the Oh My God packet, and we just said that a baby with a heart rate of 180, if they're crying, it's normal. And then I wanted you to write down on that same page 12 in the Oh My God packet that if a if a neonate's heart rate is 180 and they're quiet, they're not crying, and you get in the 180s and higher, then they automatically have a congenital heart defect. I guarantee it. They got a heart defect, y'all. It's not normal to just be sitting there minding your business and your heart all up in the 180s. That is not normal, okay? So that's cool. We got that. And then it says irregular. If you look at page 12, it says respirations what? 30 to 60. Normal neonate respirations are 30 to 60 and irregular. Now, you really got to make sure you know that. Because if you're normal like me, you'd be like, oh my God, irregular. What the fuck? What you doing? You ain't got no business being irregular. They are irregular and it's okay. Okay, so don't worry if the baby on your test has irregular respirations. That's normal. Okay, then let's go a little bit further. There's some blood sugar issues. Whose blood sugar do we check and why? Which newborns do we check? The mother is a diabetic. And here's the thing. You got to tell me if you're checking the baby's blood sugar and the mother is a diabetic, the baby could be, and I'm going to ask every single one of you, so get ready. In the back, hello y'all. The baby could have, if the mother's a diabetic and you're checking this newborn baby's blood sugar, what could the baby have? You just have two choices, 50% chance of getting this right. Don't waste my time. Could it be high or low? Could the babies be high or low if the mother's a diabetic? Come on now, 50% chance. We can do this. Okay. Don't make me bust y'all in your face. Yeah, right, because you're riding with them. Right. Okay, y'all got it. Now, here's the deal. This is the coolest thing you got to understand. Because it's very natural to say, well, I mean, she's a diabetic, her baby's going to be high. No, here's our deal. The pregnant patient, while the baby's inside of them, their blood sugar is high. That's the patient. Sugar crosses the placenta, but insulin does not. So while the baby's inside of mommy, we are getting juicier and juicier and fatter because sugar's crossing the placenta, but insulin does not. So we look like a sumo wrestler. That's how big and fat and juicy we are. That's why these patients have 10 pounds, 11 pounds, 12 pounds of baby. That's why, if you remember that story that was in the news, and I did a video about it, that short little girl who, when she delivered, the doctor popped the head off the baby. When you really look into the story, it makes perfect sense as to how that happened. I looked at everything in the story. That short little thing, which is a risk factor, being short, that short little thing who had gained way too much weight if you saw her, and she was a diabetic even before she got pregnant, which makes her very high risk for making a really big sumo wrestler. And when you deliver, that shoulders gets stuck. So you call that shoulder dystocia. The diabetic mom has a very high risk of shoulder dystocia. Now this baby, once they come up out of mommy, when they come up out of mommy, they now have No more steady supply of syrupy sweet honey on top blood that mama had. Y'all feeling me yet? Now they have nothing. They have their own blood supply. And get this, they got a brand new pancreas that works exceptionally well. What does a pancreas produce? Insulin. They ain't had no insulin, remember that? So they come out of mama, their pancreas kicks in and says, what the fuck? Your blood sugar high, little baby. When you was inside of mama, you was high. You coming out, them pancreas kicked in and made you what? Low. Because they're brand new pancreas. And get this, you real big. So you need a lot of food and you're not getting it right away because you're brand new. What is you having, steak and potatoes? Nah, you brand new. So that's why those babies are at risk for hypoglycemia when they're born. And we check them at birth, then we do it every half hour. And look what I wrote on page 12 in your Oh My God packet. I wrote that, and it's different depending on their life, the age of the baby. It says blood sugar greater than 45 is normal within what? 4 hours of life. Remember it like this, 45, 4 hours. Okay, now look what I wrote. Then 50 after that is normal. So you need greater than 50 after those 4 hours. Like, okay, we should have ate some by now. Okay. Okay. Now, so let's have a little fun with our case study. When we look at this again, we have a 2-day-old baby boy in the newborn nursery delivered by C-section. Let's stop right there because somebody said that and you was thebomb.com. What happens with a C-section that is important for the nurse to know with a baby? What is it about a C-section and the baby, not the mama? What's going on with the baby of a mother that had a C-section? Is it just as fine as a baby that was born vaginally? No. So what could be happening with the baby? Their oxygen could be low because they are not getting squeezed out of the birth canal like they do when you have a vaginal delivery. And that is very important. Not to mention, if you ever seen a C-section, we just plop them out. So they wet as hell. We got to suction for days. So the whole natural process is not happening, okay? So those babies are at more risk of respiratory distress. You might want to know that, okay? Now, let's keep going because y'all the bomb. Y'all the bomb.com. I see y'all working it today. Y'all didn't get sleepy after lunch, huh? Okay, now how many weeks are we? 39. All right, let's work it. What is considered full term?
38. 37.
I heard 37. That's good. To what?
42.
42. Say my baby. Okay, so 37 to 42 weeks is full term. Now, this baby is 39. Are we concerned? Nah. Okay? All right, so let's keep on reading because what we doing? This is what we doing if you ain't figured the shit out yet. We're recognizing cues and then we're taking it a step further and analyzing that shit. So we recognize a C-section was a cue. Like that was kind of like not the normal process. What did it mean? When I analyze it, means the baby's at risk for respiratory distress. Are you with me still?
Yeah.
We also recognize that the baby had irregular respiratory rate, but we analyzed that that was normal for a neonate. Okay, so we got it up off the board again. Okay, and the little fast heart rate, baby was crying, we good. Okay, so here we go. 39 weeks for breech presentation. Is that a big deal with the baby? Is that like a cue?
Yeah.
It is a cue, and I want you to, and use this as your study guide and put peds on top of it. Let's tell you why it's a cue. Being breech is a cue because 3% of babies are breech because they can't physically turn around on their own. What kind of problems do those babies have? It happened in my own family, Sherry's sister. Those babies have Down syndrome, cerebral palsy. So some babies are breech because they can't physically turn around. And what's supposed to happen when the mother enters her third trimester, which is around 28 weeks or so, the patient, the baby, the fetus, their head is supposed to be the largest part. Don't forget I said that shit. So it is supposed to literally vertically pull the head down to the cervix and be head first, because it's the heaviest part, so it's supposed to naturally get the baby head down. When they're breech, sometimes like with the Down syndrome baby, it's because their head is smaller, or like with cerebral palsy, they can't physically maneuver to get their head down. Okay, so yeah, breech does kind of matter. And every time I've ever had a breech patient, I have mentioned that to them. Tiny little nugget of, this is very common, every blue moon, super rare. We see that it's because the baby can't physically turn, like something's going on, like, very seldom, very rare. I mentioned Down syndrome or cerebral palsy. Okay, and I did have one that was the case. Okay, so that's cool, we got it. All right, let's move on because we're doing it. This baby was presenting with a brief episode of circumoral cyanosis. Okay, be careful on your test when they try to use words like a brief, because it sounds like it wasn't that big a deal, don't it? It's just a brief. No, motherfucker. It's more than just some brief garbage, because once you use the word, peep this, once you use that word, I don't give a fuck how brief it was. That's what I want you to take up out of here with you today. Once I use this horrible, awful, catastrophic word, once I use this word, all bets is off. We going to somebody's x-ray, echo, you getting out of here. Okay, so circumoral is never normal. Ever in a million fucking years. It's never normal. That's like a little red flag on your test. But guess what is? Acrocyanosis is normal, right? So you might want to know that one, because that's a common one on your test. And let's make sure we know how long is normal, because everything is relative to how old is your baby. So we're going around again. We're going to start over here. Honey, baby girl with the cute little bun-buns, this child here. How long is it normal for your baby that, well, first of all, what is this, y'all? Let's look at it together, shall we?
Like discoloration of the hand and the toe.
Yes, because acro means around.
Right.
Okay, acro, area, your whole area, outside, external area. This is blue, hands and feet. How long is that okay?
Within 24 hours, you should be done.
Okay, how long is it okay?
24 hours.
What you got?
24 hours.
What you got? How about you? This little baby. What about you, hon?
8 hours.
What you got?
I say 4.
What you got, baby? How long is that normal? How long is that normal? I just need a time frame. 4 hours? What you got?
1 hour?
What you got? What you got? How about you, baby?
You got baby? I think my baby was moved to the next level. I guess you.
Him.
5 minutes?
5 minutes?
4 hours.
4 hours? 2 hours?
Say 2 hours.
2 hours? 2 hours?
2.
1 hour? Okay, now, I won't bash you in your face or shank you in your kidney, because it's a very hard question, but it is always on the test. So, baby that ain't with the rest of them, what you get?
1 or 2.
You said 1 or 2? You get one answer, honey. Okay, so you said 2, right, Essence? Okay, what you got, Essence? It's Essence and Essence. What the fuck y'all doing to me today? Both of these damn Essence sat right by each other.
3 days.
3 days?
5 minutes,
5 minutes?
hour.
Everyone always misses it. You won't forget it. 11 days. Totally normal. That's why you the nurse, so you don't let these little women freak out. So blue hands and feet is completely normal for the next 10, 11 days. Okay, so you want to know that. Trust me. Okay.
Why is it so long because of the circulation?
Yeah, it just takes a minute. Takes a little while for them to get used to everything, and it don't even mean that they're necessarily cold. It's just the way it is. Okay, now, so y'all good. So what did we learn? Acrocyanosis is normal in a neonate for the first week or two, and then circumoral is an emergency. That's what we learned. Okay, all right. And then it says, brief episode of circumoral cyanosis while crying and has been noted by the pediatric intern to have a benign systolic ejection murmur that will go away with age. Now, I do like this part. Write this down on this page. I teach you for babies that diastolic murmurs mean to die. Systolic is fine. So diastolic means to die. They're not fine in a newborn. Systolic murmurs are fine. Diastolic is not. Diastolic, die. Y'all good? Okay, now we on our vital signs. And one of y'all babies, raise your hand. You said 96.6 was some bullshit. Well, y'all was damn sure right. Very good. This is horrible. And I want you to know that many babies show that they're having problems in those first few days of life. Because remember, you're only with us for a couple days and you're going home by not ever getting their temperature up to normal. This is a red flag. A cold baby is a red flag. Something else may be going on. And if you can't get this baby warm, they're going to start burning their brown fat and they're going to go into acidosis. Okay, y'all, very nice. Now, the pulse. We now know what's going on with this heart rate. But even in our heart of hearts, listen to me clearly. Even in our hearts of hearts, although we know 180 and crying is normal, when you take this heart rate and the cyanosis, the circumoral cyanosis, it kind of makes you go, I better watch this, don't it? I better watch for what? When the baby stops crying, did it come down? That's simple. Because what's normal with a quiet baby? 120 to 160s. So it's kind of like not a big deal in and of itself, but because we done did some bullshit about our mouth with the blueness, it's like, that better come down. You see what I'm saying?
So where should our temperature be at?
98.6, like us. Yeah, okay. Okay, babies. Now, the respiratory rate, y'all, what's normal?
30 to 60.
30 to 60. We cool with this, ain't we? Okay. Then it says irregular. We learned that was all right. And then it said acrocyanosis. That's fine. Skin model. That's how newborns look. They just look like you could see straight through their skin. Okay, that's just how they look. Okay. And, let me say this. This is a good one for you. Write it down. If they are overdue or what we call post dates, their skin will be wrinkly. The bottoms of their feet are wrinkly with lots of creases. And that's always on the test. The bottom of their feet is wrinkly with lots of creases. And they have no, watch me right, they have no lanugo and barely any vernix. What is vernix? The cheesy stuff. Now, let me teach you a little something, because, you know, once you know there's a God, it's kind of amazing, this whole childbirth thing. So every time I'm delivering a baby, I'm like, God is in this room. It's so fucking amazing, right? It's like a high. So when you understand all of his amazing creation, you just be like, what the fuck? You so fucking cool. Okay, so let's look at vernix first. It used to be, my stepmother was one of them. It used to be when a baby was born and had all this crap on them, they had aides to take a harsh ass scrub brush and scrub it off of them. Then evidence-based medicine. Evidence-based medicine analyzed this cheesy, creamy crap that's all over the baby, and it has the same chemical properties as lanolin.
Really?
Lotion. That's how come they come out beautiful and not toe up from the floor up from being in water for 9 months. So we now know, nurses on a test, that you let that vernix absorb in their skin and just wipe off the excess. We ain't scrubbing shit. We're just letting it absorb and let it do its lanolin thing and protect their skin. Lanugo is a fine hair on the baby. And yes, you better know this. The more premature they are, the more lanugo. The older your baby is, the less lanugo. So these are how we can tell when people come all up in my house with no prenatal care, delivering on the spot, teenagers at Beechwood Mall. This is how we know whether your baby premature or not. Because we don't have no chart on you. We don't know what we about to get. And so when they're born, and you came in here from mall shopping, I know you was pregnant. When you deliver, I can look at this baby and tell, oh shit, it's real early, y'all. We got to get it to the NICU or whatever, okay? So the skin tells you everything. The lanugo tells you everything. The vernix tells you everything. And if this baby is preemie, it's going to be smooth skin. It's going to be almost see-through. You can see a bunch of stuff through their skin, okay? Because you can't go by size. Because I just told your ass that 12-pounders come out of diabetics. So if we born 6 pounds and you're not on your P's and Q's about this, you might think, 6 pounds, we full term. No, there is all this black hair over this baby. There's a shitload of vernix, and I can see straight through their skin. They're premature. You see how that goes? Yeah. They just premature baby from a diabetic mom. Okay, so that's how you're working with it. Now, if we look at this, you will see the question 1 of 6. And I want you to pay attention to the language. Look what I wrote. Question 1 of 6, clinical judgment, recognize cues. Every time you get a case study, and by the way, you will get a minimum of 3. Look what I wrote. You're going to get at least 3 of these. At least. My students always pass an 85. They get 3 to 5 of these. So, but you got to get 3 to even have a test. You got to get 3. Each of these types of case studies, the ones that we're doing right now together, is called an unfolding case study. All the unfolding case studies are 6 questions each. That's what it is. It's 6 questions each. So if you don't have 6 questions, it's not an unfolding case study. So once you see, we got 6 questions, think about it like this. If you got at least 3, there's 6 questions each. 3 times 6 is 18. Hell, you gonna get by 85 questions? That'd be pretty sweet if you can knock them out in the case study. So you got 18. They throw out, how many do they throw out? 15. Boom. You can do this. Then if you get more than 3, okay, since I just told you, you guys really do good on case studies. Once you get the hang of it, you're pretty cool with them. So your highlight is when you get one. Okay, so here we go. You get at least 3. So if all of them have 6 questions, you got to remember every single unfolding case study. Question number 1 is always recognize the cues. Always. So focus on that when you're answering that first question. So here we go, y'all. Let's say clinical judgment, recognize the cues. The nurse reviews the assessment findings for the newborn. Which findings are to be expected in the newborn? Let's do it together because we know a little something up in this bitch. What about respirations 56 and irregular? Which one would you check? Normal. So go ahead and check it. Go in a circle or scribble it in or whatever you're doing. Acrocyanosis lasting most of the day. Normal. Heart rate 176 with crying. Normal. Oh, y'all jamming now. Look at this shit here. Presence of a murmur. Normal. Because they didn't specify which kind. So you find babies always have murmurs, in other words. Relaxed body posture. Abnormal. When they come out, if you done had kids before, you know they supposed to be real happy balled up. That's how they were inside of you. This shit don't work so well. Okay, so they like to be what? What is it gonna say in your test? Watch this. Flexed. Not what? Extended. Not extended. No, they like to be flexed down to their little fists. Remember? Think about it. Even if you ain't never had no baby, you know them babies you can't hardly get a finger in there. They be flexing, man. Just think flexing. Okay, all right, so you got it. Occasional coughing with nasal breathing. Normal. It is. It's very normal, especially a C-section baby. Okay. Now, I want you to write a word so you don't mess this up on the test. Did you notice how it said nasal breathing? I want you to write somewhere in that little line, write this word. Newborns are obligate nose breathers. Now, obligate means you're obligated to breathe through your nose. So here's what's so sad. I remember being pregnant with my second one, and boy was I lucky with that one. I planned her, I had everything I needed. I was a nurse by then and everything. So I'm sitting there with my husband's mom, who I call mom. But at the time, I don't even know if I called her mom yet. I don't remember. I hadn't known her but a few years. So I'm sitting there with her. We both watching the news. I'm this pregnant. And on the news, they got a daycare, and they had put duct tape over this baby's mouth and nose so they would stop crying. Well, the nose is so small, and no, they put it over the mouth, but the nose was so small and the baby had a cold. So you know when a baby got a cold, they crabby anyway. So they got tired of it and just duct taped the mouth. The problem is this is an obligate nose breather. And if the nose is occluded because it has a cold, they're gonna die. That's why, what do we say for babies? What is that little, what do they give you before you go home? A bulb suction. This wasn't because they was bored and wanted to give you some bullshit. This is a life saving, right? That's sweet. No, this is life saving, because if you cover this patient's nose, they cannot breathe out of their mouth. They can't. So you have to keep their nose clear. So I'm sitting there with my mama, and it was a daycare, and I'm like, oh my God, that's what makes me so scared. I hate daycares. I said, I've been looking at the different ones now. I don't even know where to put this baby. She looked at me like I had just stabbed her mama. She said, oh, you don't know? Our babies don't do daycare. I was like, oh, I hit the motherfucking jackpot. Because my oldest one did it every day. So she did not have that doting grandmother. My youngest never saw daycare. That was heaven. And she never got sick. She never had a problem. Never did. She rotten, but I mean, you know, whatever. She used to come up the stairs. When they be around old people all the time, that's how they come up the stairs. Ooh, Lord. My head. I'm like, you 3. Fuck is your hip hurt at 3? Oh my God. Okay, now, so you see it says occasional coughing and nasal breathing on your test. That's going to be obligate nose breathing. Okay, skin model, normal. Axillary temp,
Abnormal.
hell to the no, that's abnormal. Oh, there's one. Blood sugar, 53 at 2 hours. Normal. Presence of a macular papular rash on the trunk. Normal, and put in your parentheses or whatever you want to do. Put newborn rash.
Is it that little green?
It's red.
Red?
Especially on white babies. It's real like pink, like it look like acne. You don't see it as much on black babies. Okay, but it's totally normal. Jaundice, sclera noted on exam today.
That's normal.
That's normal. Yeah, remember what it says, noted on exam today. So breastfeeding jaundice, make sure you know it, is going to start around day 2. And it is very normal, and as you breastfeed more and more, and once the milk comes in, the jaundice will start to clear, because the way we get rid of bilirubin in our body is we poop and pee it out. So the way it works is as her milk comes in and she feeds more often, this baby's jaundice sclera should go away. And then only when it doesn't do we test them. Okay, so that was a good one. Black tarry stool, difficult to remove, ×2. Normal, what's it called? Meconium. What is it?
The first passing.
Is it blood or not?
No.
Yes, it is. Black tarry stools is always blood. But whose
This ain't
blood
bad blood.
is it?
Mommy's blood.
Mommy's blood. He's perfect. He made no mistakes. So that's all her little extra blood coming out of this baby, because now they're starting to do their own thing with their own blood. So remember that, because I need my babies to be sharp as hell. And black tarry stools is still blood. It's just in this case, we're not worried. Okay? All right. Infant with 9% body weight loss since birth. Normal. Remember, they lose up to 10% of their body weight. I'm going to say that again. They lose up to 10% of their body weight. The only time it's okay to lose weight as a baby. Fine crackles bilaterally. Normal with the C-section.
Right.
Because they came out with it.
Yep, they came out wet. Very good, and write that down the way I said it. Normal with the C-section. Okay, so y'all getting an idea of how this works? Okay.
You gotta keep like going back to everything.
Yeah, you really do. You